Hi, everybody. Chibuzo Opara, co-founder and co-CEO of Drugstock. Drugstock is a cloud-based pharmaceutical distribution platform that connects manufacturers of good quality pharmaceutical products to hospitals and pharmacies. See, we're solving for the fragmented supply chain system that exists in sub-Saharan Africa. And three critical challenges arise as a result of this. The first is intransparent pricing due to the unscrupulous activities of middlemen. See, anywhere between 2 and 64 times the price of international price reference for pharmaceutical products is what the Nigerian pharmaceutical consumer has to deal with. Second thing is an influx of counterfeit and substandard medication into the supply chain, leading to thousands of issues with regards to consumers consuming these pharmaceutical products. The third issue is that hospitals and pharmacies, providers, patients alike struggle with access to pharmaceutical supply chain because it's not easy to navigate this convoluted, fragmented system. At Drugstock, we seek to tackle these challenges by creating a bulletproof supply chain system that end-to-end creates a traceable and trackable way of delivering products straight from the manufacturer's warehouse to the hospital and pharmacy shelves. At Drugstock, we do this by providing hospitals and pharmacies the ability to, within 24 hours of placing their order, have their pharmaceutical products delivered to the hospital and pharmacies at their convenience with fair pricing and sustainable financial solutions for them to be able to run sustainable healthcare businesses and operations. Since we launched in 2017, we've grown from 20 facilities where we piloted to over 1,500 hospitals and pharmacies in 2020 who deal with us month on month for their pharmaceutical products. We've also serviced over 9 million prescriptions in 2020 through our partners and ecosystem. At Drugstock, we're different from the typical pharmaceutical distribution companies and in similar companies that provide services like us through our experiential understanding of the pharmaceutical supply chain. We grew out of this system having struggled to navigate this system while we're running hospitals and pharmacies. We also seek to change the industry from its typical push to a pull system where access comes to whoever needs the products and not necessarily pharmaceutical products being pushed into a system that is fragmented with pharmaceutical products building up in certain places and having no pharmaceutical products in other places. We're seeking to expand up and out of Lagos to cover a population of 90 million people in the next 4 years from our population that we cover of over 8 million people through our partners. We want to do this through our prize series A round, which is currently ongoing. It's been oversubscribed, but we're still looking for symbiotic partners to drive working capital solutions, drive client financial solutions, in addition to expanding quality of care and our technology stack offerings. Thank you very much. Join us in this crusade as we seek to drive up the quality of care for sub-Saharan Africa. Thank you and enjoy the rest of the ADN event.
Do you believe a human life is worth $1.50? Angel, a 23-year-old mother, could not avail it, and that not only cost her life, but also denied her newborn the first motherly embrace. At Clinic Pesa, we are out to tackle this biggest problem, which is affecting Africa with over 1.18 billion people without access to healthcare financing. And in Uganda, where I come from, we have only 0.7% of the market having access to healthcare financing. Of course, this is attributed to the high insurance costs and as well as the bias of the community that we are, the African community. The market is quite big. If Clinic Pesa is to capture the market is a $35 billion market, growing at a rate of 6% as of 2016. And we believe at Clinic Pesa that this problem has our solution is the solution to this problem. By providing a mobile medical bank that enables people to actually save up as less as 30 cents USD and be able to use this to pay for their medical bills on a daily, weekly, and monthly basis. And in the event that they do not have enough to pay for their medical bill, then we extend them a medical loan top-up of up to $1,000 to complete their medical bill at our clinic-based healthcare partners. How we generate revenues? We generate revenues through interest on the savings, and also we generate revenue through interest on each loan that we advance to a customer to complete their medical bill. We also generate revenue through transactional fees on withdrawals and transfers. As of date, we so far completed a pilot with over 400 customers and 2 healthcare providers. We've also built our infrastructure for scale, and this quarter we are actually running a commercial pilot with 50,000 users, and we successfully partnered with 1,200 healthcare partners, and we've also successfully partnered with MTN to give us access to 12 million customers for our Q2 commercial scale, and also successfully partnered with Equity Bank for interest on the savings. We have a great team, with me taking the lead and my co-founder also bringing experience on the side of operations. And then we have diverse skill set coming from different backgrounds at the roles of director and advisory board as well. We're seeking a $2 million hybrid round that is going to help us serve 1.4 million customers in the next 12 months, launch 2 new services, and also grow our network of healthcare partners by a double-fold, and disburse at least 3 million medical loan top-ups in the next 12 months. Thank you.
Housing is a major entry point for public health programs and primary prevention. My name is Winnie Getao, the co-founder of Congo Quake Limited. We are a design, manufacture, building company redefining affordable housing in Nairobi, Kenya. There are more than 1.6 billion people in the world living in inadequate housing. 2 million people in Nairobi live in informal structures. They are made of iron sheets, bush pole, or mud. This is because they earn less than $6 a day and can only afford to rent a home for less than $45. These homes are insecure, they have poor access to sanitation, and in more often than not, too hot or too cold depending with the weather. Congo Quake Limited builds home using precast concrete technology. They mitigate climate change. The houses are low in maintenance, therefore easy to clean and reduces spread of diseases. They also provide access to sanitation. All construction materials are sourced locally. This also includes labor. We have seen an increase in sales. This is basically due to decrease of household income caused by COVID. People are looking for cheaper, safer, as well as decent housing that is costing less. With your support, we will build more than 200 units in 2021. We will break even in 2023. We are raising $200,000 as grants. 150,000 will be used as a mini mortgage. This will construct 66 homes, provide 300 people with safe, healthy homes, and also create jobs for 250 people. 50,000 will be used for product development, creating a 2-story solution, as well as improving of ventilation and air quality, thereby increasing sales. The $200,000 will trigger an already secured 150,000 funds that will increase your impact by 3x. By 2023, we will have provided 2,500 people with safe, secure homes, over 7,500 children in safer classrooms.